Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices.
Hello, everybody. My name is Lichi Leong. Lichi is my first name, and I work at Northwest Health Law Advocates. I apologize for not being on camera, but I am in rural Washington, and my bandwidth is limited. So today, we are here to talk about immigrant health expansions in Washington and how you can help. So very excited to share this information with you and very much appreciate all of you taking an interest, especially at this challenging time in our nation and our state. So health shapes not only our lives, but it also shapes what we can do with our lives. And that's why Northwest Health Law Advocates has worked to achieve health equity for over 25 years. And today, I'm going to focus on the immigrant health expansions in Washington because back in 2019, while Washington was celebrating the fact that we got our uninsured rate down below 6%, advocates also recognized that 1 out of every 4 people who didn't have coverage lacked access to coverage because of their federal immigration status, or lack thereof, more specifically. So in recognition of that, Washington has taken some steps to address that. And by talking about who's excluded by immigration law in the U.S. So the vast majority of people in the U.S. without federal immigration status are visible minorities. This isn't an accident. This is the predictable result of an immigration system that was built on racist exclusion and assumptions. This pie chart shows the regions of origin for the United States in 2022 of individuals without federal immigration status. As you can see, across the United States, roughly 2/3 of people came from South or Central America or Mexico, and the next largest chunk came from Asia, and then smaller chunks came from the Caribbean, Africa, the Mideast, and Europe and Canada. So that's what things look like nationwide. In Washington, our pie looks a little bit different. So while the vast majority of undocumented Washingtonians are still visible minorities, the largest communities of undocumented Washingtonians actually come from Asia and the Pacific Islands. 43% of people who are undocumented come from Asia or the Pacific Islands. 39% identify as Hispanic or Latin, and 14% as non-Hispanic white, with a balance made up by people who are non-Hispanic Black or Indigenous or mixed race. It's worth remembering that undocumented communities and people of color are often different than the expectations that people often have in their heads. So I wanted to also ground us in the immigrant health coverage expansion timeline. Washington used to be a real leader in health coverage. Some of you may recall we had a program for low-income people starting in the 80s called Basic Health. And that was available to low-income people regardless of immigration status. In the 2000s, coverage was extended to low-income kids regardless of immigration status. Unfortunately, with the Great Recession, Basic Health was ended. And since that time, advocates have slowly worked to build back coverage for adults. We expanded Medicaid family planning regardless of immigration status. We expanded our postpartum program to 12 months regardless of status. And in 2023, Washington won a 1332 waiver. And we'll talk more about that in a sec. So I want to be clear that our 1332 waiver was part of a much broader legislative strategy. The pandemic really illustrated that we're healthier when everyone has access to medical care. So in 2021, legislators directed state agencies to authorize state subsidies, what has become known as Cascade Care Savings, They also launched the groundbreaking work to get a 1332 waiver and started to explore the possibility of a state Medicaid equivalent program for undocumented adults. I want to thank all of the individuals, the hundreds of individuals and organizations that sent supportive comments. We collaborated to gather over 400 supportive comments during the state comment period and hundreds more during the federal comment period. And we secured premium assistance for people up to 250% of the federal poverty level, with an additional $10 million made available contingent on the approval of the 1332 waiver. And that funding began January of last year. So, moving ahead, I do want to reassure everyone that the 1332 has guardrails. Stepping back for a moment, the Affordable Care Act did a lot of great things. It ended discrimination for at least 135 million people with pre-existing conditions on the individual market. It provided federal funding for marketplaces and the Children's Health Program. It also included a poison pill, which extracted a congressional compromise that excluded people without federal immigration status from using their own money to buy health coverage on exchanges. But Section 1332 of the Affordable Care Act allows states to say, we think we can do things better, and we would like to waive specific parts of the Affordable Care Act. And you're allowed to, provided that the scope of coverage remains the same. Basically, that means as many people would be covered as would be covered without the waiver. Coverage needs to remain affordable. Coverage and cost-sharing protections against excessive out-of-pocket spending need to provide coverage that's at least as affordable as it would be without the waiver. Coverage needs to be comprehensive, again, as comprehensive as it would be without the waiver. And it cannot increase the federal deficit, which is what's called deficit neutrality. So as long as these guardrails aren't violated, CMS can approve waivers for states. And what does that mean? That means, as of last year, any Washingtonian can shop for health coverage on Health Plan Finder. And we're the first state in the nation to do this. Undocumented immigrants cannot access federal tax credits, APTCs or EPTCs, but Washington is using state funds for premium assistance, and all Washingtonians who meet the income guideline of up to 250% of the federal poverty level can access those as long as funding is available. And all that meant that over 100,000 of our neighbors, family members, community members gained access, even though affordability challenges absolutely remain, which we'll talk more about. So a little reminder about immigrant health coverage. Folks who are undocumented still do have access to a number of programs and had access even prior to 2024. So as I mentioned, Apple Health for Kids is open to people regardless of immigration status. Pregnancy-related Apple Health is available regardless of immigration status. Postpartum coverage is available. I also want to emphasize that hospital charity care has no residency requirement. That means half of all the people in Washington are eligible for free or discounted care from most hospitals. Free care for people up to 250% of the federal poverty level, and discounted care for people up to 400% of the federal poverty level at many hospitals, most of the major hospitals. There's also a program of emergency care that helps people who do not qualify for federal Medicaid, but who have certain health conditions and whose income is up to 138% of the federal poverty level. All of that was in place prior to our immigrant health expansions last year, and hopefully will continue to be in place. We'll talk more about the budget deficit in a few minutes. So November 2023, all Washingtonians started to be able to purchase health insurance on Health Plan Finder. They could also verify their identity by talking to a health coverage navigator, which means that they didn't actually have to upload documents. Important to note also that people with income, again, up to 250% of the federal poverty level, were eligible for up to $250 a month in state premium assistance called Cascade Care Savings. Last July, the Apple Health Medicaid-like program launched, and 12,000 people gained coverage. Last autumn, folks who are recipients of Deferred Action for Childhood Arrivals and a number of other immigration statuses gained eligibility to receive advanced premium tax credits. And that brings us to today, where our legislators are drafting a budget for 2025 to 2027 with a revenue shortfall and a fairly dicey national landscape moving forward. So I do want to flag that Washington's 1332 has specific privacy provisions. Our health benefit exchange, when they negotiated the terms and conditions of the 1332 waiver, it intentionally negotiated additional protections, and that means that only aggregate data, not personally identifiable data, is shared with the federal government. So who are we talking about when we're talking about uninsured and undocumented adults? Well, we're talking about over 100,000 people in Washington, and this pie chart gives you a sense of the income distribution. So basically, 2/3 of undocumented people in 2023 gained access to being able to not only shop on the exchange, but to also access Cascade Care Savings. That's 2 blue slices of the pie. And in July, that third 0 to 138, 35,000 people became eligible for the Apple Health expansion, that Medicaid-like program. So moving to how we got here, over 100 organizations were part of the multi-year campaign to advocate for health coverage. We really encouraged a community-informed approach that prioritized equity for people who were uninsured and underinsured due to federal immigration status restrictions. And you can see a few of the logos from the organizations that were core to this effort. So, in summary, what did we gain in 2024? 2 things. 1, everyone could shop for health coverage on Health Plan Finder, and those up to 250% of the federal poverty level could get premium assistance. In July 2024, undocumented immigrants with incomes up to 138% of the federal poverty level became eligible for Apple Health. The funding is currently capped, but people can still apply to be considered if and when space becomes available, even today. So the budget conversations this session are very sobering, but I want to emphasize that undocumented households in Washington paid over $880 million in state and local taxes in 2023. So the Apple Health expansion is really about fairness and really about making sure the social safety net extends to all of us. So, given that you all are the Physicians for a National Health Program, I'm curious whether any of you have experience with Apple Health expansion coverage. Do your patients have Apple Health expansion coverage to your knowledge? And if so, do they benefit? Or, in contrast, do you have patients without coverage due to immigration status who still face challenges? I meant this to be interactive. Given the audio challenges, I'm not sure if that's a reasonable expectation. I encourage you to speak up if you're a provider who wants to share, or feel free to add in chat, or we can move forward with the slides. All right, so I will move forward One of the things that we did to try to encourage folks to share information about the program was we partnered with a number of community-based organizations and encouraged people to connect with a navigator and remind people that you may not have federal immigration status, but you can still verify your identification by talking to a navigator or ringing customer service. We also sought to reassure people that applying for health coverage is not considered a public charge. That question comes up a lot. It came up a lot during the first Trump administration, and I expect it'll come up again, since it never went away as a question. But spreading the word and making sure communities know about potential benefits is a key need in making sure people have access to programs that can help them. So I'd mentioned that affordability challenges still remain. And while we're really grateful to the legislature for providing state subsidies for lower income folks, this slide really illustrates how different state subsidies are and federal subsidies are. So this illustration, the slide was put together by the Health Benefit Exchange. A hypothetical 35-year-old customer in King County whose income is under 250% of the federal poverty level could shop on the exchange and find a health plan for $378 a month. If she were eligible for federal subsidies, she could get $366 knocked off, and she could also get another $12 of Cascade Care savings, bringing her net premium down to $0. By contrast, someone without access to federal subsidies could get a maximum of $250 a month in Cascade Care savings, but they'd still be looking to pay $128 a month in that monthly premium. And if you're at 250% of the federal poverty level, that's a pretty big chunk of your budget. So we did see when DACA folks and folks with select other immigration statuses became eligibility for advanced premium tax credits last autumn, that DACA folks and those folks moved from the right-hand column of not federally subsidized to that middle column of federally subsidized. And so our understanding is hundreds of people were able to move from, paying $100 plus a month to paying nothing for health coverage, which is great. However, the reality is folks who are undocumented are allowed to shop on the exchange, but quite frankly, health coverage is really expensive for many people, and that's still a barrier for many folks. And we would like Washington to do better. So I also want to flag some other ways Washington could do better. So on the left, you may recognize the pie chart I shared at the beginning of my presentation, that pie chart of undocumented Washingtonians. The pie chart to the right is the demographics, the self-reported demographics of the people who are actually enrolled in Apple Health expansion. Over 80% self-identify as Hispanic, and fewer than 10% self-identify as non-Hispanic. That gray slice are people who did not respond to the question. So word got out in the Spanish-speaking community. Other communities did not receive the same kind of outreach, and that is reflected in these two pie charts. Also, you may recall that about 35,000 people are eligible for the Apple Health expansion, but because funding was capped, only about 12,000 people got in. So again, we could do better. We would like Washington to do better. So another way of looking at this data is looking at language preference for people who enrolled in Apple Health expansion. Again, almost 80% of people prefer Spanish, so lots of Spanish language outreach. By contrast, different dialects of Chinese, Vietnamese, and Russian are actually the most prevalent languages other than English and Spanish in Washington. And as you can see, less than 1% of communities that prefer some dialect of Chinese, Russian, or Vietnamese, which had fewer than 10 requests, and so that data was actually suppressed, were able to enroll in the Apple Health expansion last July. So language access could certainly be improved on. I will say the Health Benefit Exchange did translate their materials into, I want to say, 23 languages. However, they also made decisions to fund only a small group of community-based organizations, ultimately fewer than 10, and they chose to not fund groups serving the Chinese, Vietnamese, or Russian-speaking communities. And I think you can see the results of that on the slide. Looking at the people who tried to gain access to Apple Health expansion, but came too late, you can also see that vast majority of people prefer speaking Spanish. Interestingly, surprisingly large chunk prefer Portuguese, which there are many fewer speakers of in Washington than speakers of Russian, Vietnamese, or Chinese dialects, but good outreach in the Portuguese-speaking community as well. When we talk about language access, I think it's important to remember that there's a lot of diversity in terms of not only the languages people speak, but also in terms of what those differences look like. As you can see in this chart, just over 25% of people who identify as Hispanic report speaking English less than very well. And that's in contrast to 30% of people who identify as being Asian alone. And within folks who identify as Asian, disaggregating the data, you can see that 49% of people who speak Vietnamese report speaking English less than very well. And over 35% of people who identify as Chinese speak English less than very well. In contrast, only 15% of people who identify as Asian Indian. Pivoting to where we are now, I think you all know that Washington is facing at least a $12 billion deficit. Our governor says at least a $15 billion deficit over the four-year outlook. That's pretty staggering considering our budget is about $70 billion. So yesterday we got the revenue forecast. Next week, we expect to see budget drafts from the legislature. We would really encourage you, this is the first action request, to join us in asking for funding for the Apple Health expansion and continued funding for Cascade Care Savings, because these two immigrant health programs are essential. Session goes until April 27th, or I should say session is scheduled to continue until April 27th. We'll see if there's any special session this year. And then the budget goes into effect this July. So also want to note that progressive revenue can mitigate cuts, but we still expect cuts because it's a really big hole in our budget. So on the topic of revenue, the Washington Democrats released what's called Book One from Governor Inslee's proposal. You may remember that Governor Inslee, as he was leaving office, did share a proposed budget in December, and it was surprisingly rosy. It was surprisingly rosy because it assumed there would be new revenue. That was Book Two, which was released publicly. He was also responsible for putting together a budget that assumed no new revenue. And looking at that budget, it included catastrophic cuts, over $3.5 billion from healthcare, over $1.1 billion from higher ed, over $1.3 billion from human services and early learning. Really essential services is what would happen if we had no new revenue. Digging down into healthcare, that Book One budget will completely eliminate the Apple Health expansion program that I've spent perhaps too long talking about today. It would also eliminate the Children's Health Insurance Program and interpreter services, which today are still federally required, as well as state kidney dialysis. Literally, people would die if these cuts were implemented. Interestingly, the Republicans released a budget proposal. This was before the revenue forecast was last week. But I confess, I was actually surprised in a good way They stated their overarching priority was to preserve and maintain services, which is, rhetoric that people use, but they actually did include Apple Health expansion. The cut that they proposed was moving the Apple Health expansion program from the current managed care model to the fee-for-service model. And we'll talk more about that in a sec. But they kept the program, which was a very pleasant surprise last week. So my question for you as physicians or providers is, as a reminder, the state-funded Apple Health for Kids program and pregnancy-related coverage is fee-for-service. What that means is that rather than being a Molina patient or a CHPW patient, people just have Apple Health. What we've heard anecdotally over the years is that being a fee-for-service patient means that you're going to have access issues. We heard time and time again, quote, providers don't take Medicaid coupons. So my question for you is, do you have any patients who have Apple Health fee-for-service to your knowledge? This population, it's undocumented kids and undocumented pregnant people, or people who have been pregnant in the past year. If you have patients who have Apple Health fee-for-service, do they have trouble finding providers, finding specialists? Again, we've heard from a few people that this is the case. We've asked for data from the Healthcare Authority. They have not shared that data with us yet. So given our audio challenges, I'm going to ask that folks put that information in chat, and we can talk about this once I'm done with my slides. So ways you can take action. I would really ask you to contact your elected officials and tell them no cut. We would rather see progressive revenue. We would also ask that legislators support funding for the Apple Health expansion program. That means protecting funding for those 12,000 Washingtonians. Additionally, we would support continuation of Cascade Care savings. Right now, it's set to expire after this year. We would really like Cascade Care savings to continue after this year because it helps people. And again, if you have any insights into fee-for-service, would appreciate you sharing those. I see that I am running sort of late, so I'm going to go quickly through my next few slides. I mentioned the 1332 waiver. There's been a change in the federal administration, so the Health Benefit Exchange is doing some contingency planning. Their core principles are to A, maintain the current waiver as long as possible so people can stay covered. Secondly, maintain privacy for the folks who are gaining access through the 1332 waiver. So if the federal government proposes any changes to the waiver that would decrease the protections in place currently, the Health Benefit Exchange would seek to end the 1332 waiver. The exchange also hopes to avoid any mid-year coverage disruption, if at all possible, and is currently working on creating a pathway to allow people to still access coverage and have access to state subsidies, TBD. I also want to mention that you may have heard of an executive order that came out just about a month ago that stated that the federal government was tasking agencies to look at people who are immigrants, who are getting benefits, and identifying which agencies were providing benefits, presumably laying the groundwork for DOJ to do its thing. But I want to be really clear that the executive order does not actually change current eligibility. People who are undocumented or not lawfully present have very little access to federal public benefits. The few benefits they are eligible for are largely codified in law, which can't be changed by an executive order. So basically, this executive order was designed to frighten people. If individuals have questions, we would encourage them to contact a trusted community-based organization. We expect that agencies are submitting their reports now. We will see whether or not the federal agencies provide any transparency of what was shared with them. I wouldn't want to wager a guess at this point, but protecting immigrant families will share information as it becomes available. Also, you may have heard of this proposed marketplace integrity and affordability rule. The proposed rule has a deadline of April 11th for public comment, so just a few weeks. The proposed rule reverses access for DACA recipients to federal subsidies, that thing that I said was so great and really helped affordability for DACA Plus folks. It also proposes ending open enrollment a month early on December 15th rather than January 15th in Washington. It also removes gender-affirming care from the list of essential benefits and eliminates special enrollment periods for low-income individuals. So not a good rule. We anticipate many federal advocates will be drafting public comments. Northwest Health Law advocates will also draft comments. I would encourage you to consider commenting if you have insight to share, or just say, this is a terrible idea, please don't be evil. So I will, if you will allow me just an extra minute, because we got started a little late, I want to emphasize that Medicaid is essential to our state's health. 1 in 4 people is covered by Medicaid or Apple Health or a related program. 1 in 3 babies is born covered by Apple Health. Nearly 1 in 2 kids are covered by Medicaid, which we call Apple Health. Medicaid funding actually makes up a quarter of our budget here in Washington. So any cuts to Medicaid would be devastating to our state. We are encouraging people to tell Congress not to cut Medicaid. Congress has proposed $880 billion in cuts. That would be horrific, and it would threaten coverage for 1 in 3 people in Washington Congressional District 5, which is outlined in orange on this slide, i.e. Spokane and the eastern side of our state. It would actually be even worse for Congressional District 4. Almost 2 in 5 people could lose coverage. That, again, funny shaped district outlined in orange on this slide, where 36.5% of individuals are covered by Apple Health. There is an organizing effort called Central WA Families, Central Washington Families, that is trying to organize to help educate Rep. Newhouse about how essential Medicaid is. If you want to help them, you can visit centralwafamilies.org. I would encourage you to take action. Please contact your congressional reps. Say no cuts to Medicaid. If it moves you, please comment on CMS's proposed rule. Please understand that immigrants and anyone who doesn't read as part of the dominant culture is scared right now. And please share resources with them. There are Know Your Rights cards in 23 languages. Northwest Immigrant Rights Project issued an advisory for nonprofits and social service providers. The National Immigration Law Center issued guidance for healthcare providers about knowing your rights as a provider and your patient's rights. I will drop all these links in chat once I stop sharing. And so in summary, priority actions are contacting your elected officials, people in Olympia to say no cuts to health and social services, yes to progressive revenue. Please support funding for Apple Health expansion. Please support continuing Cascade Care savings. Please also contact your congressional reps to say no cuts to Medicaid. And if you have Apple Health expansion or fee-for-service insights, please let me know. We're trying to collect data. And please share immigrant rights resources. So hyperlinks, I'll put those in chat. Thank you. If you want to learn more, I'm going to try to answer a few questions if you have any. You can also visit NOHLA.org, NOHLA.org. And you can always email me if you have questions. My email is right there. It's just my first name, Lee.Chi@NOHLA.org. So I'll stop sharing, and it looks like y'all have been real busy in chat. I just want to call out and say thank you to folks who have been commenting on chat. If chat could be shared with me, I would really appreciate that. I see that Melissa said, I have patients with, I presume, fee-for-service, and it's hard to get specialists. And Sarah said Medicaid before managed care was actually much easier. And billing under managed care became a nightmare, which is helpful context to have, because I think that there's an assumption that access has improved in MCOs, but certainly I think the experience of providers is important to keep in mind, and would love to talk more if you have the time and inclination. And yes, FQHCs do take fee for service. FQHCs are our safety net providers, and we are very grateful to them. And so I'm just going to take a minute to drop a few resources in chat, because I do think that this is a really scary time for people, and it is important to be able to share what resources we can. So Asians Advancing Justice in Atlanta actually have Know Your Rights cards about ICE in 23 languages, which is fantastic. And if you haven't seen the Northwest Immigrant Rights Project guidance for nonprofits, it is very, very helpful. And so that is the Northwest Immigrant Rights Project, or NIRP, resource. So it's Washington State specific. And the NILC, because we all love acronyms, even when they make no sense, has this very handy provider and patients' rights Know Your Rights resource, and Know Your Patients' Rights.
I just have a brief story to tell that illustrates the problems of managed care. I had, so this was all before 2002, and managed care had taken over the Healthy Options program, which was our state's Medicaid managed care thing. I had two patients, each of whom had allergic rhinitis, in other words, a runny nose in the allergy season, and they needed medication. And each responded to a different antihistamine. As you might realize, antihistamines are somewhat individualized. People will respond to one better than to another, etc. So patient A responded well to antihistamine X. Patient B responded well to antihistamine Y. So I wrote prescriptions, and I got information back from their insurers. And the insurer for A said, we won't cover X, but we'll cover Y. And the insurer for B said, we'll cover Y, but we won't cover Y, but it will cover X. So I wrote a letter to both of the insurance companies, and I said, the temptation is to write the prescriptions the way you want them and have the patients meet in the parking lot and exchange their bottles of antihistamines. I heard back from one, both of them said, oh, don't worry, we'll cover it. But one of them said, did it in a letter, the other one just did it. But it's just an illustration of the kind of stupidity that you get into with managed care. Just for fun.
I appreciate that insight, Sarah. I mean, I think that denials by insurance carriers is definitely something that people struggle with, and it is helpful to have that insight. So thank you for sharing.
Say that on April 2nd, Healthcare as a Human Right is having a demonstration down the steps of the Capitol from 12:30 to 1:30, and the theme of that is don't balance the budgets on the back of our most vulnerable. So that would fit in with what you've been saying, because they got these budget cuts that I guess they have to do, but if they have to do some, don't take it away. away from the healthcare needs of the people who need it the most. So that'll be April 2nd. I'll be going down there. David Loud, you're probably going down there too, right? So maybe we can help people with rides if they'd like to go and be picked up.
I see that Hugh has left his comment in chat. Gizmos are failing, so we lefties need to keep pushing for human rights for all. Agree. So if there aren't any other questions, I think that was sort of my presentation. Thank you, David. If folks have questions in the future or want to be in touch about anything, I will drop my email in chat. It's just my first name, lee.chi@nola.org. I also still answer my telephone during business hours. So I will also drop my phone in chat in case anyone wants to get in touch.
Well, again, thank you so much for putting up with this technical problem. And I think it's got to do with security and the Zoom bombers that have really invaded lots of other Zoom spaces. So I'll get in touch with Zoom tomorrow, but I'll do as well as I can with the recording. I'm hoping that they didn't do anything, but normally I get the recording on my computer and I, see it and download it along with the chat and go through it and edit out a few things and put it up on the YouTube channel along with a blast about the meeting in a day or two. So
edit out the swear words.
I think I managed to avoid swearing, but, life feels like a dumpster fire, so sometimes it happens. Well, thank you all of you for letting me share some information, and feel free to be in touch, and have a good night and stay safe all.
Okay, thanks
Bye-bye.
again. Bye-bye.